Dear colleagues, are you listening me? Dear colleagues, are you listening me? Check quality of sound. 2, it's a bad, poor quality. 5, high quality of sound. "21 students was online, very good. I need more than 25 students. I need more than 25 students. Dear colleagues, I ask you, I wait you. I am very glad. I am very glad that our sound very good. No, dear colleagues, come back to the broadcasting. Come back to the broadcasting. Not so many students. Come back. Oh, 21 students, very good. 22 students, nice. I wait 5 more students at least. At least 5 more students. Oh, 25 students, very good. Now I start. Now I send video. Now I open video. Just a moment. I open video in my phone. Good morning, dear colleagues. Good morning, dear colleagues. Today our lecture about mental retardations. Now I wait video in my phone. Okay. Now everything's okay. Mental retardations. Now we use new terms, intellectual disability. I pay your attention. In up-to-date English medical language, we don't use terms medical retardations. We use terms intellectual disability. Next, very interesting. My opinion in the international classification of the diseases in 11 terms more correct. Intellectual development disability. What's important in these words, in these sentences? In these sentences, important words, development disorders. I explain these topics after some times, okay? Okay, now you understand. We can use the three terms: mental retardations, intellectual disability, or intellectual development disability. My opinion, very correct terms, intellectual development disability. It's very, very correct terms. DSM-5 for intellectual disability. Intellectual development disorders, it's a disorders with onset during the development period that included both intellections and adaptive functions. Defects is conceptual, social, and practical domains. The following three criteria must be present. What's important in these definitions? In these definitions, very important, first, disability must be development in the development period. Disability must start in the development period. What does it mean, development period? Development period, I mean it's a childhood period. It's a childhood period. Other very important criteria. Problems must be present in the three domains. First, conceptual, it means thinking. Second, social. And third, practical. What does it mean? It means child must have problems in the interpersonal relation. Child must have problems in the everyday living. It's a practical domain. And child must have problems in the learning, in the cognitive domain. Now we speak about three criteria which present in the DSM-5 classification. DSM-5 is a United States classifications of the mental and behavioral disorders. Why we use this criteria? This criteria very understandable, and for education and scientific purpose we very often use DSM criteria. But it's a pity in the everyday practice we use ICD-10 criteria. I think after some years we will use ICD-11 criteria. Okay, criteria A. Defect in intellectual functions such as reasoning, problem solving, planning, abstract thinking, judgment, academic learning, and learning from experience. What does it mean, learning from experience? Learning from experience, it means it's an everyday practice. How to use transport, how to use cash withdrawal machine, how to use coffee machine, how to use a municipal transport, how to use plastic card, how to use word around ourselves. Okay, now we understand. Now we discuss about a conceptual domain. Planning. What does mean planning? Understand what's happy in future. Planning, it means you do something right now and you understand what influence your current activity what's influence of the current activity in future. Abstract thinking. What does mean abstract thinking? Abstract thinking it's a ability to manipulate with object which absent in the sensory fields. For example, you can manipulate with object which absent in your sensory field. Very easy example. Now I think maybe a screwdriver absent in your sensory fields. What does mean sensory fields? You don't see screwdriver, but you can understand how to use screwdriver. For example, in your mind, you can create picture how to use a screwdriver for repair something. For example, how to use screwdriver for repair, maybe I don't know, for repair your furniture. It's a abstract thinking. In abstract thinking, you can understand something like university. University, it's not only building, correct? University, it's a systems. It's a systems which may be situated in building, may be situated like now virtuality in different place in computer. It's a documents. It's a interpersonal relations. Yes, it's not a one place. Person without abstract thinking cannot understand terms like a government, like a university, like a institutions. He can understand this is concrete building, it's a university. What does mean government? Government, it's the peoples which sit down in those buildings. Abstract thinking, it's a very powerful tools for manipulate with reality, because in abstract thinking you combine sensory image with perception image. You like a combine two type of image, sensory image and perception image. You can manipulate with image which absent in your reality. You remember that our reality is activity of the cortex in the sensory fields. Academic learning. Very often we recognize mental retardations in school, in the first class of the school. It's a young school. Why it's in the primary school? Why it's happy? It's happy because, for example, person has enough ability to use word around himself. Abstract thinking absent in child because abstract thinking developing completely after 12 years ago. Person can manipulate with object around himself. He can speak something, but when he start learning in school, he has a serious academic problems. After that, due psychological examination, we can recognize some problems in learning, in educations. Oh. How to check this ability? Yes, of course. First, we can check via interview about everyday functions. Second, it's a psychological test. For psychological test, usually we use a clinical psychologist. It's not a doctor duty use a psychological test, because doctor use a clinical scale, clinical test, and psychologists use psychological test. Psychological test more wide, much more wide and sensitive. Criteria D, adaptation. Deflect in adaptive functions that result in failure to meet development and social culture standard of the personal independence and social responsibility. What has been social responsibility? First, social responsibility usually starting in the early school. In early school, person first has a problems with academic result. Second, in early school, person has a lot of duty, a lot of interpersonal contact, because very often a child living in young before school, living with relatives, maybe with parents only, and contact with very close social environment. In school, social environment very large. It's a teacher, it's other child, it's other school boys and school girls. And we need a lot of ability for create interpersonal contact. In different situations, we must use a different pattern of behavior. Because when a child every time in home, he has only one environment, like how to do something in home and near the home. In school, we have a lot of situation. First situation, it's a class, during the class time. Second situation, it's a break. Third situation, after class. Next situation, relations with teacher in class. Next situation, relation with teacher after class in break. Relations with students during the class times. Relation with other students in break. It's absolutely different relations. And very often person which has a mental retardation has a serious problems in contact with teacher, in contact with other students. And first rings, my opinion, if child has a lot of complaints about own behavior, if you see like these patients which has a lot of problems in school, in interaction with teacher, in interaction with child. Next, very important criteria. Very often, relatives or parents shift this child in other school, but in other school, these problems present. What does it mean? It means does not matter in what situations, but child has a problems. We must think about intellectual development disorders. Maybe patient has problems in the adaptive domain. Okay, without ongoing support, that adaptive deflect limit functions is one or more adaptive of daily life, such as communication, socials, practitioners, and independent living across multiply environment. What has been multiply environment? It's a school, but I explain. In a home environment, not so wide because not so many social situation. In school, a lot of environment. And after that, we have a time before class and after class. Next, we have other social situations. In school, it's a break because relations with other students in break, after and before class, during the class, absolutely different. Very often patient which has problems with adaptation functions show this deflect in the early school, in the first class of the school. And after that criteria number 3, it's a C. Development in onset of the intellectual and adaptive deflect during the development period. Development period we mean before 12 years ago, because 12 years after 12 years ago, person has intelligence, person has enough abstract thinking, person has enough abstract thinking. Yes, of course, abstract thinking development very not like jumping. It's a very slow process. But usually this process finishing after 12 years ago. Maybe something 12, maybe something more. But in 12 years ago, after 12 years ago, child must has a very wide abstract thinking. How to check abstract thinking? Yes, of course, psychological test. If you think then patient has some problems with abstract thinking, direct this person to the psychological examinations. Okay, three domain. First domain, it's a conceptual, social, practice domain. Adaptation, I mean, yes, I repeat once more. Deflect in adaptive functions based in the 3 problems. It's a 3 problems. First problem, the conceptual domains. It's mean academic functions. How to reading, how to calculating, how to writing. It's a conceptual domain. Yes, of course, if person cannot reading after 10 years ago, yes, of course, this person has a serious problems with adaptation. If person cannot write after 10 years ago, yes, of course, it's a serious problems in adaptations. Social domain. How to speak with teacher, how to speak with other child, how to contact with teacher, how to contact with police, how to contact with neighbors, how to contact with other person. You understand, every new phase in a social situation, it's a new pattern of behavior. Because you remember, what does it mean personality? Personality is a favorite pattern of behavior which different in different situations, but stable during the time, like a same in same situations, yes, but different in different situations and unique from one person to other person. And practical domain, how to use transport, how to use I don't know, smartphone, how to use some applications, how to use a key, and a lot of functions. Now you understand. Then if patient has a defect in any of these domains, in general is be influenced to adaptive functions. Academic domains involves competence in memory, language, reading, writing, much reasoning, practical knowledge, problem solving, judgment in novel situation. What does it mean, judgment? Judgment. It's mean you use previous experience and skills. It's a learning. You understand? What does it mean, learning? Learning, it's mean you use former experience and skills for resolving new situations. It's a learning functions. Conceptual academic domain, very important. I repeat once more. Very often in home, child has a very good support from side of the relatives and parents, and we not recognize conceptual problems in the conceptual domain in home, but in school a lot of new situations and problems in behavior and in marks in young school, in early school. It's like a rings. It's a very important alarm. It's not a rings, it's maybe alarm. We must direct this person to the psychologist. I hope it's clear for you. Next, social domain. What does it mean, social function? Social functions, it's mean interaction, one person with other person. For example, in class and after class, I has something different relation with you, yes? But in general, in university, in class, I has one type of relation with you. If I meet you not in university, in city, I have something other relation with you, yes? Because I understand a social feature of situations. Patient which has a intellectual disability usually don't feel social situation, and as result he don't understand he don't understand what does it mean empathy. Empathy, it's mean you feel, you understand emotion of other person. For example, if you see that other person has a bad mood, you don't touch those person, you don't speak with this of those person about something. If person has some problems with in some situations, you try don't touch those situations because you understand these discussions very traumatic for this person. I repeat once more. Empathy, you understand other person emotion. Sympathy. Sympathy, it's mean you has a same emotions like a person. In sympathy, you has, it's like a same wave in emotions. One person has a bad mood, you has a bad mood. Other person has a positive emotions, you has a positive emotion. It's a sympathy. It's like your emotions and other person emotions same. What does it mean empathy? It's your emotions, it's other person emotions. Other person emotion changes, but your emotion looks like a stability. But you understand what emotion feel other person. It's very important feelings for the social contact. I pay you attention. These feelings very important in the interpersonal relations. These feelings background, it's a important skills in doctor-patient relations. Patient which has a mental retardation, patient which has intellectual disability, usually cannot understand empathy. Maybe he can feel a sympathy, but he like a reflecting emotions. Interpersonal communication skills. I explain. It's mean for special situations, special feelings. Clear? For special situations, special feeling, special behavior. I'm sorry. For special situation, special behavior. Different situation, different behavior. We use, for example, different communication skills with same person in different situation. For example, in exam, in class, after class, in class break, after the class, you has a different relation with teacher. You cannot use relation with teacher in exam like a relation with teacher like in class. I hope it's clear for you. Practical domain. What has been practical domain? Learning. We have two terms. Learning and education. What does it mean learning? Learning is an automatic process. During this process, you receive new experience and skills and use former experience and skills for resolving current situation. Clear? In learning, it means you can apply former experience and skills in new situations. I pay attention. It's happy without your activity. It's an automatic process. For example, you do something and after some times you do something very good. For example, you have a good experience to use some computer games. It's you play in the computer games and your experience increasing. It's a learning. Educations, it's an active process. In educations, you like learn some ability which no need right now. Clear? Learning, it means you do something which you need do right now. You use transport, you use, I don't know, you use shop, you use plastic card, online banking. You need and you use and learning. Educations, something no need right now. For example, no need information about medicine right now. I hope everybody has a good health right now. But you learn in medicine. Clear? You receive medical education. It means you receive knowledge which no need right now. You learn materials without practical background. It's very important. Clear? Okay. Now we discuss learning. It's a more base function than education. It's a more deep. If patient has a defect in learning, it's a more deep defect than in education. Education, it's a more high functions. Learning, personal career, yes, job responsibility, money management. It's yes, of course, we can learn you how to manage personal finance. We have a special class like a personal finance class. Self-management, school and work task, organizations, contact with other person. Okay, now you understand. Learning not only in practice like a use screwdriver, learning how to contact with boss, learning how to contact with teacher, learning how to show, how to express emotions. Everything's for all of this situation we use learning. We use previous experience and skills for resolve current situations. Patient which has a mental retardations has a problems with learning, has problems with educations. Like in education, we receive knowledge about matching, writing. In learning, we receive information about self career, about personal self management, and these more difficult problems. It's more difficult problems. Level of intellectual disability. Yes, of course, we have a three stage: mild, moderate, severe, and profound. Now we speak about mild. Who is a person with mild mental retardations? Those children are considered educatable, and they usually are able to attend special classes and to work towards as the long-term goals of the being able to function in the community and to hold some type of job. They usually can learn to read, write, perform simple arithmetic operations. Who is this child? It's a child usual without what's essential in this person. Essential in this person has not abstract thinking. Problems with abstract thinking. This person this person usually very straightly. This person not understand double means. This person not understand humors. This person think only things which they cannot lay in general. They cannot lie. They cannot lie. Why? Lie, it's like a create a new words. Yes, like you have a real words. It's a true words. What does it mean? Lie. Lie. It's mean you create a new words and with different situations which absent in reality. A person which has a mild mental retardations manipulate without problems with reality. It's mean object which present in current environment, and has problems to manipulate with object which absent in reality. For example, this person can without problems do some operation with object which present in sensory field, like assemble something. If present example, do simple operation, simple job which need a creativity, often decision impossible for this person in future. I hope you understand. Next type, moderate. Yes, of course, majority of person which has a mental retardation, it's moderate. Oh, sorry, it's a mild. I repeat once more. Mild mental retardation, it's a person which don't understand humors. Maybe if they can do a lot of operation, but only if operations present manual. If present manual, this person do operation without problems. If manual very good, person be do operation without problems. But if manual not so completely, this person cannot create image how to connect to operation. Clear? This person cannot connect one operation with other operation. Okay, next, moderate. They are considerable trainable in that they can learn to talk, to recognize name and other simple word, to perform activity of the self-care such as bathing or doing their laundry, and to handle small change. They require management and treatment in special education class. Okay. Who is a person with moderate? This person which need every time support. Language. Person which has a mild mental retardation has a very wide language. Usual mild mental retardation, it's a problems in abstract thinking. Like a patient can finish a middle school with problem but finish. Person not understand humor, not understand jokes very straightly. Moderate. This person cannot finish a primary school. Language very poverty, maybe 20, maybe 50 words. Recognize some object. Manipulate with some simple object like eating something, like dressing something. But yes, of course, we cannot speak about self-career. We cannot speak about job. I mean job in adult age. Yes, of course, these patients cannot use money. This patient cannot use transport. This patient cannot connect a lot of operations. This patient cannot planning, absolutely impossible. Mild mental retardation, patient has a problem with planning. But this person like live only here and now. Usually this person living in the special home, in group home, in which present some support teams which support his life, everyday living. Severe and profound. Children with severe and profound disorders constitute the smallest groups. Individuals in these categories almost invariably require care and institutionalized setting, usually beginning early in the life. Relativity early in the life. What does it mean, this text? This text means that this person cannot support himself. Usual cannot eating, cannot dressing. Language absolutely absent. Usual length of the life of this person very short. Usual mortality due general medical conditions. Epidemiology. Intellectual disability very common, 1 or 2% in general populations. Is common in male. A ratio between men and women like a 2 till 1. Men more often. I pay your attention. 1 or 2%. It's very large. It's maybe you remember some children in your school and in class. Maybe you has a child which has a problems with interaction with teacher, interaction with other child in student in school, in class, low marks, inappropriate behavior. Usual, like this feature which I describe in this example, it's a diagnostic criteria for mild mental retardations. 1 or 2%, it means 1 or 2 class in school, 1 or 2 person, like this person present in this class. During the life, this person accommodate to living because present adaptive ability. Present can do mathematical operation, write, reading, and can do some simple job. Epidemiology. Mild disorders, it's more common in the low social classes. Why it's happy? Answer very easy. Our life, it's a social interaction. Interaction with boss. Interaction with other person. Interaction with colleagues. Our promotions, it's an interaction between different peoples. It's an interaction between different peoples. And yes, of course, for interaction between you and different peoples, you need social skills, you need learning, you need education. Yes, you learning some social situation. After that, you visit a class how to do promotion in the life. It's an education, special class how to do promotions, how to pass interview in company, present special class. It's an education. Clear, it's an education. Patient which has a mild disorders usually have not like this ability, and yes, of course, has a only very simple job like cleaning, like building, like like a low classification, low experience job. Child with moderate disorders requires the need a everyday career. No need everyday career, and majority of in group of mental retardation, it's a mild disorders. Mild disorders. What does it mean? It's mean 2% in populations. From this 2%, 85% it's a mild. Usual, you recognize it's a very pretty person which don't understand humor, which do job with a simple job without problems, and sometimes you recognize this person like a something straightly, like without humors. If this person has a good or pretty social parameter, like not so angry, friendly, this person living in society without problems. I pay attention. Majority, it's a mild mental retardations. Moderate, only 2%. I pay attention. I repeat once more. This person need everyday support. This person need everyday support, and in adult age must living in the special environment, in the group home or in like this institution. Severe and profound. This person has a serious somatic problems. Everyday support. Without support, this patient cannot do simple operations like eating, like cooking, and something like this. It's usually this child dying in a young age due general medical conditions. Thank you. Так, dear colleagues, I ask you in our chat room in contact, put your attendance, like your name and groups, clear in chat room in the contact. It's in our chat room in contact. It's like our logs. Okay, goodbye. Так, now audio present, video absent. I repeat once more. All other communication in our chat room in the contact. Goodbye.